Hi, so what's up guys? It's Monday, yay. I didn't have to work very much today, it was just 12 to 4, but I'm really tired. I think I overslept today, and anyway, today's advice will be on something that you don't, at least I haven't seen very much of it talked about. Diabetes and transgender. Like, they don't really interact directly, since the whole transgender thing is not a physical thing most of the time, more rather, I'm not trying to be mean about this. Anyway, if you don't happen to know what diabetes is, it is an autoimmune disease. Now, you'll have to pardon me, I cannot remember the definition off the top of my head, but if you quickly Google it, you can just quickly look it up, and it's fine. Basically, it caused the cells in my pancreas, which make insulin. Insulin, if you don't know, breaks down food to create energy for you. But anyway, diabetes caused my pancreas cells to attack each other, destroying the cells that make insulin. Now, that's type 1. Type 2, which is a little sadly more common, but is more common in older people, 50, 60 plus, and those who are overweight, is different. It's the opposite. It destroys the cells that take in the insulin. So basically, they're making insulin, they're making a ton of insulin, and it's just not going anywhere. That can actually be not quite treated, like go away treated, but it can actually be taken care of rather easily through diet and exercise and so on and so forth. Type 1 is harder. I have to actually take shots. Anyway. Now, if you are diabetic and transgender, first of all, let me know. I know I'm not the only one, but it'd be nice to know that there are others. But, in trying to make yourself into the person you feel you are or feel you should be, please do not forget to take care of your diabetes. Now, I'm going to look more into this research of, hormones might affect my my insulin, because insulin is a hormone. And it could very well mess it up or mess with it, and I could get really sick from it. Please talk to your doctors, both the doctor that you're talking to get hormones from, your diabetes doctor. Please discuss with them. It is going to be different based on who you are, what type of diabetes you have, which way you're going. Please, please, please talk to your doctors. I'm going to do the same, although it's going to be a lot longer before I can start hormones, so I'm not really worried about that at the moment myself. However, if you plan on doing this soon, like within the next couple of years, please talk to your diabetes doctor. Whether you're a teenager or you're young and you need to go to the children's hospital for your diabetes, or if you're like me and an adult and you need to go to an adult diabetes doctor, please talk to them. It's really important. Because I don't know how much you guys know about this. For example, having a baby, getting pregnant, that messes with your hormones, and you can actually go through a lot of issues with your diabetes because of it. I had a friend go to the hospital several times. She was fine, her and the baby are fine, but they had to go to the hospital several times during her pregnancy. That's another key important thing for trans men who still want to have kids, like me, for example. Who are diabetic. And that's also very important. Something else to think about. If you are a trans man and you still want to have babies, that is perfectly fine. That does not invalidate your gender. You can even still be mommy. I'm pretty sure I mentioned this in a different video, but for example, in the first book of Harry Potter, when Hagrid gets his little baby dragon, Norbert, and Norbert looks at him and says, "Oh, look, he knows his mummy." And he's talking about himself. It's fine. You can still be a guy and be mommy. When I start those hormones, after I have a chest surgery and I have kids, I'm still going to be mommy. When we walk around the playground and my kids are looking at me going, "Mommy, mommy, mommy," and all the other moms are going to look at me really weird because I'm a man. It doesn't matter. I'm a man. I'm comfortable with okay, I can't really say that yet, but I'm a man. Okay? For most part, I'm confident within myself that I am a man. And I'm confident that I can be called mommy. There are plenty of gay couples who one is mommy and the other is daddy. They can both be daddy, they can both be mommy. It's fine. Partially it's because I don't really want to confuse my kids because my boyfriend's going to be daddy and I'm mommy. But also it's just, I've always wanted to be a mom. And I don't know, I just don't really feel like being called daddy. But, so yeah, please don't let anyone invalidate you. If you want to have kids, go for it. Please make sure you are financially and emotionally ready. Emotionally wise, you will probably not be fully ready, ever, for kids. But as long as you believe that you are mature enough and you are able to take care of a small human being, which, trust me, takes a lot, especially within their first 5 years. Because after that, when they start school, you just have to make sure you feed them and put them to bed. Make sure you pack their lunches and such. But as they're growing up, after they're born till 5 years old, you have to keep an eye on them, especially when they start learning to crawl and walk and such. Please make sure you're ready for that. You know, before you have a kid. And please plan for this. Be careful if you're not ready for kids. But the biggest thing, even if you're not completely emotionally ready, you need to be financially ready. For example, I really want to have kids. Me and my boyfriend aren't married yet. We probably aren't going to be married for another couple years. I could have a baby right now. Emotionally, I think I'm mostly prepared, but financially, we're not even close. We probably wouldn't even have the funds to buy everything we'd need for the baby. And that doesn't include extra diapers and stuff. I mean the literal basic stuff. Which would include clothes and just one pack of diapers. We wouldn't have enough money to keep that baby alive for like a month. And I'm not trying to be mean or say we'd kill the baby. No. We just aren't ready for one. That's the fact we're waiting. So, another important thing about being transgender and having babies. If you get a top surgery, you can still have a baby. Just because you can't breastfeed them or you choose not to, doesn't mean you can't have a baby. They've made formula and other food products that a newborn can eat. Drink, you get what I mean. So it's fine. I mean, that's literally my plan. I would very much like to, if it's financially possible, to get a top surgery. And then when we're ready to have kids, I can just feed them formula. Now, the one thing that you can't do and still have kids is start hormones. Once you start hormones, that's it. It starts I can't say immediately starts, but it starts changing your body to the point you can't just suddenly stop and say, okay, I want to have a baby now. That's really important. You have to seriously think about this. Do you really want kids? Can you wait a few years to have kids and then do your hormones? Or do you really need to do your hormones right now and then maybe you can adopt in a few years? Because that's another option too. Adopting is good too. And for trans women, as far as I know, you still cannot physically have kids if you ever want to. And that actually kind of makes me sad, because to be honest, what I really want to do is after I have kids, give up like my girly bits, my ovaries and all that, and give them to some woman who cannot have kids, whether it be a trans woman or a cis woman. As far as I know, I can't do that. I can give up my eggs if they're still working, but not my ovaries. So as far as I know, trans women, I'm so sorry. If you want to have a baby, as far as I know, there's not much we can do about it. You can adopt, you can have a surrogate mother. It's about as far as your options go, and I'm so sorry. Because babies are wonderful. I've never had one, of course, but I've been around them most of my life. My grandmother babysits, my mother babysits. Babies are amazing. And I wasn't at the hospital when my niece was born because I was working. But I held her a few days after they got out of the hospital. Babies are amazing. thanks to my mom, I've always wanted to be a mom, and when I was younger, it was more easier because I was like, I'm going to grow up, get married, and have babies, because I still identified as a woman, and now that I identify as a man, it's going to be a little bit, well, I'm not sure it's going to be more difficult, but it's also going to be really, it's going to be a little hard mentally, because it's like, of course, I'm still going to be a man, but it's going to be really difficult to be like, oh, I'm a man, guys, and, you know, have a belly popping. You know, at that point, there's not a whole lot I can do, just kind of smile and nod when they say ma'am or miss, and then after that, just start my hormones and I'll be fine. So yeah, that's at least my plan. If you really want kids, and like I said, you're financially and mentally ready, go for it. On that note, please be careful. If you don't want to have kids, please wear condoms or use birth control. Please. Those condoms are also really important because if you're having sex with someone who has had sex before, it's safe. It's safer for you and for them. Not saying either of you have STDs, but it's safer. It's also safe because pre-cum can make you pregnant. So please wear condoms if you're having sex. If you're younger than 16, you shouldn't be having sex, but I'm not going to judge you if you are. Personally, I lost my virginity at 17, so it's not like I'm really judging underage people. I'm not going to judge you. Just please be careful. Please. Anyway, this has gone over a little bit longer than I meant to. I think the main point of this video is just basically diabetes and pregnancy while transgender. The biggest point overall is please take care of yourself. Whether you're diabetic or not, please remember to take care of yourself. You know, mentally and physically. Both are very important. Because if you're really physically sick, it's hard to take care of yourself mentally. If you're really mentally sick, it's really hard to take care of yourself physically. If you need help, get it. If possible. If not, please just find someone to confide in and tell them whenever you're feeling like something's not right. I'll be here for you if you need me. If you have any questions, please message me. I will look a lot more into pregnancy and transgender and also diabetes and transgender. And the next video I have should be a lot more informative. And I apologize for not being very informative at this point. Yeah. And also, please message me if you're diabetic and transgender. You know, especially if you're, God, what is that word? After you've gone through, after you've transitioned, sorry. After transitioning. Because I want to see if it is, first of all, possible, and even the internet might say it is or not, but see if it's possible, and see if there's anything special you did to help yourself. Anyway, this is going on a little longer than I wanted to. I hope you guys have a wonderful day. Please take care of yourselves, and remember that you are wonderful and your gender is valid. Alright, see you guys later.